Hello everybody, today we're going to have a look at a knee. Here's the knee. The client is having discomfort with it. He's been using a miHealth off body and it's been helping, but he's got discomfort particularly on this inside edge here, and he feels that that's having an effect on his ankles and twisting and turning the way his foot sits on the ground. So now he's used to the idea of using the miHealth off body. Today we're going to go on body. So I'm going to use matrix carrier to start with, and I'm going to put it up to about around 20%. I'm going to explore the area just to see what we find around the knee. Definitely seems to be sticking more in that area. The device is grabbing the tissue there. I'm going to go downwards. In fact, I'm having to pull it away from that area. Okay, it's running smoother there. A little bit of attraction there. It's grabbing there. Smoother again on top. And as we go further down into this area, it's sticking again. You can see the surrounding tissue is grabbing. In fact, I actually have to pull it away from there. So distinct in this area here, which ties in with the sensation the client's been getting. Now, matrix carrier is quite a low frequency and it's excellent for reconnection of tissue. And you can hear the frequency, you can hear it go tick, 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 tick. Now, obviously with something that's painful, typically you're looking at inflammation, and BioCell might be a useful one. So I'm going to go to BioCell, which is in the physical range, third from the bottom. Again, I'm going to go to intensity 3 and back to around energy 20. You can hear a slightly higher frequency there, and the device is grabbing again quite distinctly in that area. I'm pulling it away from there, moving around, basically exploring to see what sort of attraction, what sort of stickiness we're getting. Very distinct there. It looks like I'm pressing hard, but in fact I'm just drawing it across the tissue, and it's the tissue holding the device in that particular area. Now, BioCell is excellent with inflammation, but you could also use chronic and acute and rejuve. So you've got physical rejuve, chronic and acute. Now, in a tactile activity such as drawing the device over, we sense where the asymmetry is. That's the oddity in the tissue, as in the area that's different to everywhere else. And we know when we're leaving that area because it becomes much smoother, easier to move, doesn't have the vibration coming back. If I go back up into the area, it seems to grab again. So both the client feels a heightened sensitivity, but the practitioner also feels that dragging on the tissue. Now, this is the most common starting point for treatment, as well as off body. Now, if we want to go deeper into this and really isolate what's happening, we can go to the point measurement. So that's what I'm going to do today. So I'm going to go into, there we go. So I've gone to the tower block at the bottom. It looks like a tower block. In fact, it's a set of charts. I'm going to first make some measurements here. So I'm going to choose probably a center line of the knee, and I'm going to move across. Here we go. So that's the first row, and it's showing me that the fourth position is red. Now the red one is the highest value of all. I'm going to do a second row. It's still, the highest value is still the 4th row in. So I'm now going to raise the energy level a little higher, up to 20 again. 2, 3, 4. Now I'm going to hold the device there and watch the values come up. So it's gone to 108. I'm going to go back on the area. It started with initial reaction 21. It's up at around 160, 170, 180, 190, 200, 210, 220, 230, 231 the device has stopped at, so I can make a note of that. 4th position down, 231. Now I'm just going to move off to the side. So if this is our point of interest, I'm going to move to the side. Values there, climbing 140 and 144 it's stopped at. So I'm now going to go to the left of it. And 79, so I'm going to go above it. And the numbers came in at 130, so I'm going to go below it. $147, 150, 160, 170, 180, 190, 200, 215, 220, 230, 237. So we had a figure of 231 and now 237. So the actual highest point is actually just below in this area here. Let's go one more. So I'm going to go out to the left again. Okay, that's 138. Off to this side. 66. I'm not going to go above because I already know that's a high figure. I'm going to go below. We're at 120, 130, 140, 150, 160. Okay, 168. So now we know the numbers are reducing away. So actually our problem area is sitting in here. That's ideal. Now out of those two positions we know that this one here is the highest value, but there's very little between them, 230, 237. So the problem is very distinctly in that area. The client's been good enough to let me draw on his leg, so it's easy for you guys to see on the camera. So I'm now going to go back into that area, and I'm going to approach it by putting the electrodes in this manner. So we're at 150, 160, 170, 179. We go just to the side there. So I'm making sure I'm filling that box. Again, 170, 180, 190, 200, 216. So now we're looking at between this side and the side closest to me, it's the highest numbers are in this area here, so they're in this area here, and in the lower quarter is the highest numbers of all. Now we're going to bring the device horizontal again, just to get different axis on this tissue. I'm looking to see the numbers reduce. Right, 159, I'm going to go above. 150, 160, 170. So we're closing in on an area probably the size of your thumb, which is the highest values of all. So it's bringing us in 213. We go one more, just a fraction above. $170, 180, 187. So the numbers are dropping. Originally in that area we were looking at 230 plus, now we're looking at 180 or so. I'm going to choose another setting. I'm going to write down the fact I was getting those values looking at BioCell. And I'm going to go for acute balance this time. And I'm going to bring the energy up again to 20 so they're comparable. So I've now gone for measurement again. At 20 on acute balance. So this is to give the body a variety of inputs. So this came up to 112, working down through the position, 140, 150, 157, 148, and last position at the bottom of the box, 118. So now these values have dropped from over 230 to around 120. So I'm quite happy with that. I know that these values are changing. So even if the client's sensation is the same, we know that the actual tissue response is changing. And this will allow you to monitor not only functional change but actually the tissue changing. And remember, it only takes a small amount of inflammation to give a large amount of pain. So if you had a large amount of inflammation, you'd still get a large amount of pain. So the patient can't tell the difference typically. So you're monitoring with the numbers so you can track the changes in a way that doesn't rely on the patient to say it's 5 out of 10 or it's 10 out of 10. You can actually see numbers changing, and you'll see it get closer and closer to the surrounding tissue, so you know that it's effectively changing from an asymmetry, which is an area of difference, back to a balanced area. So that's a really fast, straightforward way to find the problem area, follow what the client says, treat with a tactile treatment, monitor to see how it grabs the body, whether the device sticks in that area. Try several different frequencies, and as we did, we used matrix carrier and then we tried BioCell, and that gave us some distinct changes in that area. We could recognize the problem, and then we used the point measurement to really target it, and in this case we've drawn on the knee to really get a sense of exactly where we are. I recommend you either take a photograph of the knee when you've done that, or if you sketch a knee and you can map it based on where the center line is and space that you're looking at, and then when you see the patient again next week you can check to see how things have changed. I hope that's of use to you. A nice simple way of treating directly with the miHealth without looking at the scan. You might be on a football pitch or something of this nature, and you might not have access at that moment in time. It might be a family picnic, things of that nature, when it's not as convenient to do a scan right there and then. Obviously you can do a scan after that and follow up with more targeted infoceutical treatment as you move forward. I hope that's of help.
Well, I had the pain in my right knee from an injury back in the 80s, and I've had trouble with it ever since, but lately it's been very painful. Cyril actually did a treatment with the miHealth. It took the pain away completely. There was no pain at all. The difficult bit is nighttime. Roll around in the bed and it just hurts all the time. It wakes me up in the middle of the night, but I slept without painless sleep last night. It was fantastic. Woke up this morning, I was actually able to walk and grab a cup of coffee, so it was very good. I'll be treating that again today with the miHealth because I want a little bit more of that. No pain, it worked.